Hello everyone. Welcome back to Biostube. I'm Mintesnot, and today we have the first set of 25 asthma questions, covering basic symptoms, triggers, drug therapy, and emergency cases. Grab a pen and paper, and let's see how many you can get right. And don't forget to subscribe, hit the bell icon and share so you won't miss the second part with the remaining 25 questions. 1. Which of the following is a common trigger for asthma attacks? A. Dust mites. B. Cold air. C. Exercise. D. All of the above. Answer. D. All of the above. Triggers vary, but dust, cold, and exercise can all cause asthma attacks. 2. What type of drug is salbutamol? A. Corticosteroid. B. Beta-2 agonist. C. Antihistamine. D. Leukotriene inhibitor. Answer. B. Beta-2 agonist. It is a short-acting bronchodilator used for quick relief in asthma. 3. Which medication is considered a controller for long-term asthma management? A. Salbutamol. B. Inhaled corticosteroids. C. Adrenaline. D. Oxygen. Answer. B. Inhaled corticosteroids. These reduce airway inflammation and prevent frequent attacks. 4. What is a classic symptom of asthma? A. Chest pain. B. Wheezing. C. Hemoptysis. D. Persistent fever. Answer. B. Wheezing. Wheezing is the hallmark sound caused by airway narrowing. 5. Status asthmaticus refers to A. Mild asthma attack. B. Life-threatening severe asthma not responding to treatment. C. Asthma only triggered by exercise. D. Chronic cough without wheeze. Answer. B. Life-threatening severe asthma not responding to treatment. This condition requires emergency management. 6. A 12-year-old patient presents with shortness of breath, wheezing, and nighttime cough. Which is the most likely diagnosis? A. Pneumonia. B. Asthma. C. Bronchitis. D. Tuberculosis. Answer. B. Asthma. Classic asthma symptoms include wheezing, dyspnea, and nighttime cough. Nocturnal symptoms. 7. Which of the following is a long-acting beta-2 agonist LABA used in asthma management? A. Salbutamol. B. Formoterol. C. Epinephrine. D. Ipratropium. Answer. B. Formoterol. LABAs are used for long-term control, always combined with inhaled corticosteroids. 8. What is the main role of inhaled corticosteroids in asthma? A. Relax airway smooth muscle. B. Reduce airway inflammation. C. Increase mucus production. D. Treat acute attacks. Answer. B. Reduce airway inflammation. They prevent exacerbations by controlling chronic inflammation. 9. A patient with asthma has worsening symptoms despite using a short-acting inhaler. What is the next recommended step? A. Continue current therapy. B. Add inhaled corticosteroid. C. Stop all medications. D. Only use oral antibiotics. Answer. B. Add inhaled corticosteroid. Stepwise therapy. Controller medications are added when relievers alone are insufficient. 10. Which of the following is an emergency treatment for severe asthma attack? A. Oral theophylline. B. Nebulized high-dose beta-2 agonist. C. Long-term inhaled corticosteroid. D. Antihistamine tablets. Answer. B. Nebulized high-dose beta-2 agonist. Quick bronchodilation is essential in severe exacerbations. 11. Peak flow measurement in asthma is used to A. Diagnose asthma permanently. B. Monitor airway obstruction and predict exacerbations. C. Replace inhaler therapy. D. Detect infections. Answer. B. Monitor airway obstruction and predict exacerbations. Daily peak flow monitoring helps patients recognize worsening asthma early. 12. Which of the following is true about asthma in children? A. Always presents with fever. B. Can be triggered by viral infections. C. Is not influenced by allergens. D. Never causes nighttime symptoms. Answer: B. Can be triggered by viral infections. Respiratory viruses often precipitate asthma attacks in children. 13. Which medication should never be used alone in persistent asthma? A. Short-acting beta-2 agonist. B. Long-acting beta-2 agonist LABA. C. Inhaled corticosteroid. D. Leukotriene receptor antagonist. Answer: B. Long-acting beta-2 agonist LABA. LABAs without corticosteroids increase the risk of severe attacks. 14. A patient with asthma presents with chest tightness, cough, and wheezing after exercise. What is the likely condition? A. Exercise-induced bronchoconstriction. B. Pneumothorax. C. Pulmonary embolism. D. Chronic bronchitis. Answer: A. Exercise-induced bronchoconstriction. Exercise can trigger temporary airway narrowing in asthma patients. 15. Which of the following vaccines is especially recommended for asthma patients? A. Influenza and pneumococcal vaccines. B. Varicella vaccine only. C. BCG vaccine only. D. HPV vaccine only. Answer: A. Influenza and pneumococcal vaccines. Vaccination reduces the risk of respiratory infections that can trigger asthma attacks. 16. A 7-year-old child presents with sudden severe wheezing, accessory muscle use, and oxygen saturation of 88%. What is the first-line emergency treatment? A. Oral antihistamine. B. Nebulized high-dose salbutamol. C. Oral corticosteroid only. D. Inhaled long-acting beta-2 agonist. Answer: B. Nebulized high-dose salbutamol. In severe pediatric asthma, rapid bronchodilation is critical. Oxygen and monitoring are also required. 17. A patient with asthma is prescribed both salmeterol and fluticasone. What is the main reason for this combination? A. Salmeterol reduces inflammation, fluticasone relaxes muscles. B. Fluticasone reduces inflammation, salmeterol provides long-term bronchodilation. C. Both are short-acting relievers. D. Both are rescue medications. Answer: B. Fluticasone reduces inflammation, salmeterol provides long-term bronchodilation. Combination therapy improves control and reduces exacerbations. 18. Which of the following drugs can potentially worsen asthma? A. Beta blockers. B. Leukotriene receptor antagonists. C. Inhaled corticosteroids. D. Short-acting beta-2 agonists. Answer: A. Beta blockers. Non-selective beta blockers can cause bronchospasm in asthma patients. 19. A patient reports nighttime asthma symptoms twice per week despite regular inhaler use. What is the appropriate management? A. Increased dose of inhaled corticosteroid. B. Stop inhaler. C. Only use short-acting inhaler. D. Switch to oral antibiotics. Answer: A. Increased dose of inhaled corticosteroid. Stepwise therapy requires adjusting controller medications for poor symptom control. 20. Which of the following is a common non-allergic trigger for asthma attacks? A. Pollen. B. Cold air. C. Pet dander. D. Dust mites. Answer: B. Cold air. Cold air, exercise, and viral infections are non-allergic triggers, others are allergic. 21. A 45-year-old patient with asthma complains of heart palpitations after inhaler use. Which inhaler is most likely responsible? A. Salmeterol. B. Salbutamol. C. Fluticasone. D. Montelukast. Answer: B. Salbutamol. Short-acting beta-2 agonists may cause tachycardia or palpitations. 22. What is the preferred rescue treatment in an adult with status asthmaticus? A. Oral corticosteroid. B. Nebulized high-dose beta-2 agonist plus oxygen. C. Long-term inhaled corticosteroid. D. Leukotriene inhibitor. Answer: B. Nebulized high-dose beta-2 agonist plus oxygen. Rapid bronchodilation and oxygen support are critical in life-threatening attacks. 23. A patient develops cough, hoarseness, and oral thrush from inhaled corticosteroid. What is the best preventive measure? A. Use a spacer and rinse mouth after inhalation. B. Stop medication immediately. C. Switch to oral corticosteroid. D. Reduce frequency to once a week. Answer: A. Use a spacer and rinse mouth after inhalation. Proper technique reduces local side effects. 24. Which of the following is true regarding pediatric versus adult asthma? A. Children never have nocturnal symptoms. B. Adults always have exercise-induced asthma. C. Children often present with viral-induced exacerbations. D. Asthma medications are the same for both without dose adjustment. Answer: C. Children often present with viral-induced exacerbations. Children commonly have infections triggering asthma. Dose adjustment may be needed. 25. A patient with severe asthma has persistent symptoms despite high-dose inhaled corticosteroids and LABA. What is the next step? A. Add oral corticosteroid or biologic therapy. B. Stop all inhalers. C. Only use rescue inhaler. D. Switch to antihistamines. Answer: A. Add oral corticosteroid or biologic therapy. Severe asthma may require systemic therapy or biologics targeting IgE Illinois 5 pathways. That's it for the first 25 asthma questions. How many did you get right? Comment below your score. I'm Mintesnot, and don't forget to subscribe, like, hit the bell icon and share so you won't miss the second part with the remaining 25 questions. See you in the next video.